Thank you, everybody, for joining me here today and joining Secretary Teresa Miller. Thank you for being here. And thank you, Kristen Ahrens, for being here. Over the past 3 months, we have made a lot of progress in slowing the spread of COVID-19. I keep coming back to that because we've had a lot of good news here in Pennsylvania. Now, even though more businesses are reopening, more people are returning to work, and more activities are resuming, we're still seeing sustained low new case counts, which is really good news. And Pennsylvania's peak never actually reached the heights of other states because we took early aggressive action. So this is a reduction in new cases over a small, relative to other states, peak. While other states and countries are still seeing spikes, I think the New York Times reported 23 as of this morning, states with spikes in their case counts as the reopening. That's just not happening here in Pennsylvania. And that's because we have been methodical in the way we reopen, and it's because Pennsylvanians are really taking this seriously. We haven't fallen into an either-or trap, lives versus the economy. We know that both are important, and we know that making the right decisions will result in the best outcome for both people and for businesses and for our economy. One of the ways we've done this is by making targeted investments in key areas that support Pennsylvanians, many Pennsylvanians. And these investments have included the COVID-19 Working Capital Access Program, which came from the state, which was $60 million of state money in loans to small businesses, and the Pennsylvania Hospital Emergency Loan Program, the HELP program, which allocated $450 million to provide liquidity for health systems. We also had $2.6 million in funding that we distributed to food banks and pantries through the Neighborhood Assistance Program. These are just a few of the investments that we have made right here in Pennsylvania to keep Pennsylvanians and Pennsylvania businesses as strong as possible during this pandemic. So today, we're announcing an addition to this list, a $260 million investment of CARES Act funding into support for Pennsylvanians with intellectual disabilities or autism. I've asked Secretary of Human Services Teresa Miller to join me here today to share with you more about how this funding will help. And again, as I said, Secretary Miller and Kristen Ahrens will also help with, actually not just help, but actually provide technical answers to questions if I can't answer them. But this program is going to help more than 40,000 Pennsylvanians with intellectual disabilities or autism who receive assistance through one or of Teresa's, Secretary Miller's department's programs or the Department of Human Services facilities. This funding is going to improve the quality of life for these Pennsylvanians throughout the COVID-19 crisis, but it's also going to have a broader impact. It will help keep the Pennsylvanians who have dedicated their lives to caring for these folks to help them stay healthy and safe. And it's going to provide their families and loved ones with relief in knowing that we are committed to providing the highest level of care possible, even during a pandemic like this one. These are the types of targeted and effective investments we're continuing to make as we enter the recovery phase of the COVID-19 response. With these targeted investments, we can build the strongest Pennsylvania possible as we work our way through the pandemic. And that's going to allow all of us to continue protecting lives while supporting livelihoods. So thank you very much. And now I'm pleased to turn things over to Secretary Teresa Miller. Secretary Miller.
Thank you, Governor. I did it right? Thank you for inviting me to join you here today. And my name is Teresa Miller, and I have the privilege of serving as the Secretary of the Pennsylvania Department of Human Services. As the Governor said, today we are announcing the release of $260 million in funding from the Coronavirus Aid, Relief, and Economic Security, or CARES Act, for providers that support Pennsylvanians with intellectual disabilities or autism. These dollars are intended to supplement the budgets of an industry built on the values of service, caregiving, and inclusion, an industry that's been hit particularly hard by the COVID-19 pandemic. I want to start by thanking the service providers and direct support professionals who've persevered and continue to persevere through an unprecedented crisis to maintain Pennsylvania's home and community-based system of critical supports for individuals with intellectual disabilities and autism. This pandemic has altered all of our lives in a way that we couldn't truly anticipate until it became vital to protect our families and our own health and safety. But for people who dedicate their lives to serving others, this calculus becomes much broader. They have to consider how they also protect the people that they serve, people who may need some level of hands-on assistance or support with caring for themselves, going to work and socializing, and living an everyday life. Approximately 35,000 people in Pennsylvania with intellectual disabilities and autism receive supportive services through home and community-based waivers administered by our department's Office of Developmental Programs. These individuals lead fulfilling everyday lives thanks to their relationships with family and friends and the skilled care provided by direct support professionals. As we all know, work that's rewarding is not necessarily easy. The work of direct support professionals requires a deep well of compassion, skill, and unyielding patience on a typical day. In normal times, this work can change lives and supports opportunity and inclusion for people who were formerly limited and separated from society. But in the midst of a global pandemic, this work is life-sustaining and heroic. Direct support professionals and provider organizations have been and continue to be on the front lines of this crisis. You are keeping people healthy and safe, helping them cope with the incredible changes that we've all probably struggled at times to manage through the last few months. Your work and all you do to help the people you serve feel safe and supported is important now more than ever. To all of our intellectual disability and autism service providers and direct support professionals, thank you for your tireless and selfless work over the last 3 months, and for your dedication to helping Pennsylvanians with intellectual disabilities and autism achieve the everyday life they deserve. As we look towards what we all must do to continue to fight the spread of COVID-19 and prepare for a potential second wave of increased cases, we must be mindful and help people with intellectual disabilities and autism understand the steps each of us must take to remain vigilant. While we've seen weeks of COVID-19 cases on the decline in Pennsylvania, and we begin our return to normal life, we cannot tap the brakes on our commitment to protect individuals with intellectual disabilities and autism from this dangerous and extremely contagious virus. Despite the heroic efforts of service professionals and direct support professionals to keep people in their care safe, we know that this is a vulnerable population and it's been disproportionately affected by COVID-19 in Pennsylvania and throughout the country. We can look to the science of epidemiology to understand why. People with disabilities often have co-occurring chronic health needs that can cause further complications or exacerbate COVID-19's effects on the body. In addition to this, the services being provided by direct support professionals are things like food preparation, personal care, medication assistance, transportation, skill building, and crucially, social interaction. This is not work that anyone can do without coming into close contact with the person receiving services. And they are not services that can completely stop. They're most typically life-sustaining services. DHS's Office of Developmental Programs, or ODP, has worked with our ID and autism service providers to permit adjustments to service delivery that ensures continuity of services necessary to help people meet essential needs and care for themselves while minimizing that increased risk of contracting the virus. We've also encouraged use of technology and telehealth wherever possible to supplement services and experiences that are not currently safe or feasible to provide. In addition to this, healthcare quality units funded by the department that specialize in intellectual and developmental disabilities provided support to group residential care settings on preventing COVID-19, infection control, proper use of personal protective equipment, and other topics that help providers keep residents and staff safe and navigate challenges created by this pandemic. Recently, the department has also begun to engage the Education Support and Clinical Coaching Program, or what we call ESCIP, a long-term care support system led by DHS, the Jewish Healthcare Foundation, and 7 health systems around Pennsylvania to provide consult to IDA providers. When this program transitions to the new Regional Response Health Collaborative, support for our IDA providers who provide support in congregate residential settings will continue. As counties reopen and move from yellow to green, we are working with our providers to begin to safely and gradually resume out-of-home and group services. These opportunities help people served in the system maintain critical social connections to their peers, families, and the world around them. But we must be diligent to consider risks that still exist as we look for ways to adjust to this new normal. This situation is still evolving, and the ODP team will continue to respond to questions and issue guidance as new questions and challenges arise. As long as COVID-19 remains a threat, we will continue to focus energy and resources on strategies to reduce its impact on individuals with intellectual disabilities and autism. Maintaining and strengthening Pennsylvania's system of home and community-based services is the foundation for this effort. While we are doing all we're able to support our partners and providers in the IDA autism service system through regulatory waivers and operational adjustments that allow flexibility in responding to this challenge, we also understand that this pandemic has seriously disrupted operations for many providers. These disruptions, both in this system and around Pennsylvania as a whole, were necessary to save lives and helped us successfully flatten the curve. But we must preserve this system so the crucial life-sustaining and life-enriching work that happens every day may continue. The funding that we're releasing today will help this vital network continue after what we know has been a very difficult 3 months. As I mentioned previously, $260 million in total will begin to go out today to our intellectual disability and autism service providers around Pennsylvania, specifically to offset expenses related to COVID-19. This funding includes $90 million to providers of residential, respite, and shift nursing services, $80 million to providers of community participation support services for 120 days of retainer payments covering operations from March through June, and $90 million to providers of in-home and community-supported and small group employment, companion, and transportation trip services for 120 days of retainer payments covering operations from March through June. Providers must currently participate in ODP's ID autism waiver or the adult autism waiver to qualify for this funding, which will be issued as one-time gross adjustments. These payments will start to go out to providers today and will continue through early July, and providers must use these funds by November 30th of this year, of 2020. Again, I would like to thank our ID and autism service providers and direct support professionals for their work this year and their continued dedication to helping families, friends, and neighbors with disabilities. The Department of Human Services is committed to supporting this industry and the vulnerable population that it serves throughout this crisis and into a post-pandemic world. This commitment extends to the financial solvency of the industry, the economic stability of its workforce, and the rights of individuals with intellectual disabilities and autism to lead healthy, happy, and fulfilling everyday lives. We will continue to support this workforce and people served by this system as we all continue to navigate this pandemic and the uncertain weeks and months ahead. While there may again be difficult times ahead, I know this system can continue to rise to the challenge while continuing life-sustaining and life-enriching support and care for the more than 35,000 Pennsylvanians served through home and community-based waivers administered by ODP. Thank you again for joining us today, and I'm happy to turn it back over to Governor. Is that what I should do? Open it up for questions?
Any questions? Yes.
So $260 million is a lot of money and it has to be used before November 30th. How is DHS planning to keep track of where those monies are going?
We are also having the providers who are getting these funds, they will be providing information to us and reporting how those funds are spent. So there will be tracking requirements.
Any other questions? Yes.
As a snapshot, you mentioned 35,000 folks that are in that current system. What does the current system compared to the $260 million look like on a 6-month basis of operating, where that 260 would kind of go and fit?
That's a good question. This is what, a $4 billion system? $4 billion system, so this is a year annually, is that right? $4 billion annually, so this is $260 million in the next, what is it, 6 months? July, August, September, October, November, 5, 6 months. Does that give you some sense? Yeah.
Any other questions? Yeah?
Oh, this is not related, but what is your reaction to the Supreme Court's ruling today on LGBTQ?
About time. I think we should not allow that to mean, we still have work to do in non-discrimination here in Pennsylvania, and I continue to support that. Yes?
Another question unrelated, but 2 bills regarding police reform were approved this morning. Last week, some lawmakers asked for a special session. Where are you with that? Do we know if there's going to be one?
Well, that's 2 questions. The first is I think it's a first step. I believe we have more to do, but it's a first step, and I applaud that. I certainly support that. But again, it's a first step. We have more to do. I don't think we need a special session. I think all we need to do is pass bills. We're here, and let's get them out just as we did today.
Thanks.
Mm-hmm. Anything else? Yeah.
Yes, Governor. The Supreme Court received your petition, I believe, end of last week.
This is the state Supreme Court, not
Yes,
the U.S.
state-
Supreme
yes,
Court, or U.S. Supreme Court.
PA Supreme Court, right?
Right.
Have they answered or given any kind of guidance on your petition yet?
As far as I know, not yet. We've sort of heard informally that they will get to it this week. So it's on the front burner.
And then on the Commonwealth Court side as well?
That was the General Assembly went into the Commonwealth Court. We went to the Supreme Court, so I don't know what the status is of the Commonwealth Court suit.
On masks, if I may, a week ago today, you had said they're not required. Then last Wednesday, you said that they are.
Yes, that was just out of ignorance. I didn't know what here's the point. Evidently, they are required. And so technically, anybody in authority has the ability to say you need to wear that mask or you'll be cited. In practice, we have 13 million Pennsylvanians. Each and every one of them has to make a decision on their own as to whether they're going to wear the mask or not. If they don't, they're putting the lives of their neighbors and family at risk. So it's a personal decision. That's why I keep coming back to the analogy of the stop sign. The last time, I don't remember the last time I saw a police officer at a stop sign, and yet people obey it. Well, they don't come to a full stop often or always, but they do obey it. And it's not because somebody is there citing them if they don't obey it. They're obeying it because it's in their self-interest to obey it. We need to understand that it's in the self-interest of our family members, of the people we like, the people we hang out with, for us to wear a mask. If we don't, we're putting their lives at risk.
So the biggest question that I've heard and then seen the viral videos of is Pennsylvanians would like to know where they can point to. Is there an order from yourself, from Secretary Levine, where they can go in and cite a number or an order number or a part number where they can go look and find that?
Okay. So in order not to mislead anybody, Sarah, will you get the specific and accurate answer to you so that there'll be no confusion on that? Again, the confusion should be there should be no confusion in that virus, which is the real enemy here. It's not whether we have a guidance or a regulation or who's doing it or where it's coming from. It's that virus is out to get us, each and every one of us. And everything we do to keep that virus from infecting somebody else, we're doing a good thing. And we're pretty sure that masks work. We're pretty sure that social distancing works. We're pretty sure that staying away from big crowds, those things work. So to the extent we can do those things, whether it's a legal or binding thing or not, we ought to do those things. Anything else? Yes?
Yeah, so we talked about the special session on police reform, and this is something that the Black Caucus wanted, and they asked Turzai for it. Turzai supported it, but then he put the ball in your court and asked you to call the session. What are the pros and cons of calling a special session just for police reform?
Yeah, the pros are you really focus on the special session. The cons are that if the General Assembly really doesn't want to do it, I have the constitutional ability to call a special session, but they also then could just gavel in and gavel right out without doing anything. The idea is, as some legislation was already passed, it can be fast-tracked. we don't need a special session. So if we go home and then have people come back over the summer, that I think is just taking more time. Let's do it. Let's just get it done. I support it. I'll sign it. Bring it to me. And as I said, this was what has passed is a start. We still have more to do, and a special session wouldn't really accomplish anything that actually both parties and both chambers deciding we really want to do this. Let's get it done. They can do things very quickly if they have to.
Are there any measures that you're pushing or looking forward to signing?
Yeah, there are a number. I can get you the list. I don't want to not mention some, but there's more that we need to do, and I support those measures. There's some things I can do myself, like a deputy inspector general, that doesn't require confirmation or any action from the legislature. Things like that I can do and I will do.
What's the status on that, on the inspector general?
I'm still we're working on identifying the person, but I'm moving ahead with that.
Okay, last question, anybody else? Good.
Okay, all right, and let me just say, Secretary Miller and her team have done a phenomenal job throughout this, and she's just part of a really good team, and I'm proud to have her on the team. So congratulations for everything you do. Thank you.
Kristen did all the work.
Thank you, Kristen.